Let's start. Difference inside of the fatty tissue, the same structures. Laterally 7 and 5, medially 8 and 4, posteriorly 6. So nothing is not changed. You remember, the same structure is not necessary to name. You have the names in the previous picture. You will name only the new structures. So once again, 7, 5 laterally, 8 and 4 medially, and posteriorly 6. Okay, if it's finished, let's go deep. First of all, in space 2, draw only one muscle, 12. As you can see, 13 muscle is leave this place, and 13 muscle goes to the posterior ostentatial compartment. Let's say inside of the space 2, draw only the 12 muscle. No any channel, by the way, yeah, which we have in upper third, yeah, only one muscle and nothing more. Now go to the first compartment. And look please here, the first layer of the muscle is changed. In the upper third, 16 located more laterally, 17 is located more medially. Now 16 and 17 change the places. 17 come to the lateral side, 16 goes deep. As you remember, I showed it for you that the groove in the middle third will be between the brachioradialis and will be between flexor carpi radialis, between 12 and 17. Let's say draw please the same muscles, but 17 after 16, then 18, 19, again the 20, again 21, again 22. Just 16 and 17 change the places. 17 come to the lateral side, 16 goes deep and little bit medial. All another muscular structures inside of space 1 is absolutely same. Again, you can see these 3 layers of muscles. 17, 16, 18, 19, first layer, 20, second layer, 21, 22, third layer. A little bit faster, guys. If you finish it, let's go first of all to the posterior region. In the posterior region, now you can arrangement 5 to 5. 5 muscles in superficial layer, 5 in deep. Now draw 23, 24, 25, 26, 27 inside of the superficial layer. As in previous picture, nothing is not changed. In deep layer, just one change. The muscle 13 come to the deep layer. Let's say 13, 28, 29, 30, 31, as in the previous picture. Just only one difference. Again, I say you, supinator 1 from space 2, yeah, migrated into space 2, into posterior. We finished to draw muscles. Now let's come to the vessels and nerves. Draw, please, the C groove now between 12 and 17. Inside of the groove C, the same 32 and 33, as in previous picture. Nothing is not changed. No, dear, you don't listen to me. You are in your mind. Where is the groove C in your picture? Where is it? Why you do the picture without me? Do synchro. Where it is your second or first picture? Let's say don't do it alone. Wait until I will say. Otherwise you will make mistakes. Second Brito, make it bigger. In your picture it's not recordable, the structures. Make it wider to understand what do you draw. And so once again, group C between 12 and 17, inside of group C, 32-1, it is ramus superficialis nervi radialis, 33-1, it is arteria radialis. Names is not need to be mentioned, you have it before. Let's continue. Put the ring D between the same 19 and 20 as in previous term. But now inside of it, draw double structures. It is the 35 and 34. As you remember, 35 is outside of this ring in upper third. Now it comes to the ring. 35 is arteria ulnaris, 34 it is nervus ulnaris. Now in previous picture they were separated from each other. Now, in this picture, there are together, and they form the neurovascular bundle. Continue, please. Now, between muscle 20 and muscle 22, draw the 36 and 37. This is nervus medianus and arteria mediana. Again, they migrated in upper third, they located in coronary teres. Now you see they located strongly by midline, yeah? Strongly in mid-side, between 20 and 21. 22, sorry. You have again the names, you don't need to write it once again. Now go please to deep compartment in front of the interossal membrane, draw 38 and 39. As in previous picture, no any change. This is arteria and nervus interosseous arteriole. And go back to the interossal membrane. You can find now the difference. Nervus interosseous posterior or ramus profundus nervi radialis from space 2 become to space 3. And together with 40 artery, that's at 15 and 14, draw immediately behind. Again, this is not below, this is behind. You understand, Mirita? That's all. This is whole structures in the middle third. Before I will improve the picture, draw please the empty third picture, cross section of the lower third of the forearm region. Can you tell me what is my last number in the picture?
40.
40? Okay, next one will be 41, yeah?
Yes.
Let's start. You can see, guys, that our superficial structures doesn't change anyhow. Again, laterally 7.5. Again, medially 8 and 4. Again, posteriorly 6. So absolutely same picture in all terms of our forearm. Now let's come to the deep structures again inside of space 2. The 12. By the way, 12 is stands smaller here. Yeah, by the way, guys, I don't make the change of the bone sizes. But you should understand that in reality, the more down you will come, the more will be decreased the size of ulna, and more will be increased size of the radius. Just that is not necessary because we know about it. Yeah, this is schematic of just picture. I don't mention. Now go to the space 1. Now look, please. No 16 muscle. 16, it is pronator, it is disappear here. And in first layer you have 17, 18. 18 is very small. Because palmaris longus here has the tendon form, as you can see, yeah? The tendon form. It's in the lower third, it has the form of the tendon, very small. And 19 one, that's a first layer, 17, 18, and 19. Layer number 2, the same, 20. 1 minute attention. Layer number 3, 21, 22, but one more layer is happening here. Layer number 41, one more muscle, fourth layer, 41 muscle, and call it please pronator quadratus. That's it. In both previous pictures, anteriorly we have 3 layers. In these pictures, anteriorly we have 4 layers. Once again, 17, 18, 19. Layer 1, 20, layer 2, 21, 22, layer 3, and 41, it is new structure, that's a right name, it is pronator quadratus muscle. One more layer in anterior forearm. 41 structure, which is called pronator quadratus. Is it understandable for you? Let's go to the back side. In layer 1, the same, 23 to 27. 5 muscles. In layer 2, supinator is disappeared. In the lower third, we don't have. That's all right, 28, 29, 30, 31. 4 layers, as in upper third. In upper third also, yeah, we don't have here supinator. Supinator inside of space 2. If you finish, guys, let's start to draw the vessels and nerves. Again, draw, please, the C-ring. It is the radial groove, but only one structure inside of it. It is artery, number 33. There is the nerve. 1 minute, look to the picture and find it, please, just under the posterior interosseal septa, in posterior compartment, 32 nerve, which is superficial branch of the nervus radialis. The name doesn't write, just put this point. Again, I mention it for you. Nervus radialis doesn't have any tension to your palm. That's a branches, it goes to the backside to innervate it, the dorsal surface of the hand. In ventral surface or palmar surface, we will achieve only medium and ulnar innervation. So remember about it, please. Let's continue. Put the same D groove also. Put the same D groove also. Call it, please, ulnar groove. Ulnar groove. And inside of it, draw the same 35 and 36, 34, structures. 34, it is nervus ulnaris. 35, it is arteria ulnaris. Let's continue. Put the new ring E between 17 and 20 structures. Call it sulcus medianus. This is new structure. You should write the name of it. Sulcus medianus. You see, this groove is located only in lower third. How it forms? Medially 20, laterally 17. By the way, from in front, it is covered by the tendon of 18 muscle, palmaris longus. And inside of it, draw 36 and 37. 36, it is nervus medianus. 37, it is arteria mediana. Now draw the 38 and 39 under the fourth muscular layer, just in front of your interossal membrane. And from 39, provide the line into the posterior compartment and draw it once again behind of the interossal membrane. As I draw in two places, and in front and behind of interossal. What does it mean? In the border between forearm and hand, it is perforated the interossal membrane and come to the backside to forms the arterial network of the dorsal hand. So remember, please, it doesn't go to the palm, it comes to the dorsal. That's like we draw it twice to show that in the lower third it will make this movement from in front to behind. Now come to the backside. Again, 32, 39, which we mentioned before. And look, guys, the 15 and 14 change the position. Previously, they rotated deeper. Now they come to more superficial between first and second muscular layers. Draw them, please. Names you know, it's not necessary to mention. Names you know, it's not necessary to mention. That's all, friends. We finished the discussion of the forearm region. Point by point, all the structures is described and given for you. Use this cross section. I will not start the hand because in the next week I will have more than enough time to speak about it, and technically we can say that our lesson is finished. If you have questions or if you want to answer, I will be ready to give you this chance. Please.
42 is mentioned.
Space, pyrogosis.
42, yeah, please. I'm very sorry, I forget to say. Right, now 1 minute attention to me, guys. You can see that second, third, and fourth muscular layers doesn't touch to each other. There are deep loose connective space, right? Please, 42 we call deep loose connective, otherwise Pirogov space. In the brackets, right, please, it can communicate to downwards with canalis carpalis and with the synovial sheaths, which is located inside of it. In the next hour meeting, guys, we'll remember anatomy of your hand, and I will remind you that between head and forearm, there are several channels. In the backside, 6, in front, 3. From medial to lateral, it is carpi ulnar channel, canalis carpalis, and canalis carpi radialis. In the back, it is the 6 canals with the tendons of the extensors, which is and by the way, they form the anatomical snuff boxes, you remember, yeah? Between the channel number 1 and channel number 3. Channel number 4 located in the floor of this anatomical snuff. So we will remember this structure, we will revise these structures, but this is an important loose connective. It's connected with the canalis carpalis, and if will be inflammation inside of the carpal channel, it can be spread in this Pirogov space, and here we can have pus. What else? Goodbye and good luck.